Hey doc, is my total joint replacement infected? I am worried.
Stop, drop, and roll. This topic is fire.
Okay.
It is hard to tell sometimes.
Yes.
Very difficult. The people have done research, papers, and studies to try and help develop guidelines so that doctors and patients can know if there's a PJI, a prosthetic joint infection.
Okay.
Okay, but we're going to tell you some of the symptoms that you may be experiencing that may suggest that, yeah, you may have a prosthetic joint infection.
And believe me, you worry about it, we worry about it. There's a high fear factor related to the infected total joint. This is whether it's a hip, a knee, shoulder, whatever. We're mostly talking about hips and knees today, but it applies to all of them.
And the reason we worry about it so much is because it can be a devastating complication of a prosthetic joint, because more often than not, it means you need more surgery and maybe more than just one more surgical procedure.
Right.
All right.
So we're gonna give you our top 5 things to look for that make you worried about it. And we would always say, if you're worried, reach out to your healthcare practitioner, maybe to your surgeon, if you're worried about it, to find out.
All right.
What's number 1? Number 1 on the list.
Pain that's getting worse. You're sitting there, you've had a joint replacement, for example, a knee replacement, you're saying, yeah, right, it always hurts.
But it was going down.
You're right, it always hurts. It might even blip up a little bit, but on the whole, over a few days or weeks, it's just getting worse and worse and worse and worse. That's the wrong direction.
I agree. Increasing pain outside of new trauma.
I always ask people too, I always say, when they say they're still having knee pain at like 6 weeks, I'm like, is it better than it was 3 weeks ago?
Agreed. Okay, number 2 for me, it's red and it's swollen. And a lot of joint replacement incisions and the areas around the incision in that limb can be a little bit red and can be a little bit swollen, but trending in the wrong direction. So more red or persistently red, or it's spreading and more swollen. So the swelling in and out of the area is getting thicker, not less thick.
Okay.
Not thick with 2 C's, just 1 C.
Yeah,
Okay.
I like that. The next one is systemic symptoms, okay? When we have an infection, it's an inflammatory process, and you may have some systemic symptoms from it. You may feel sick, fatigued, those typical things you feel when you get sick generally, because you may have generalized sickness associated with it.
Okay, number 4 for me, and this maybe is my number 1 if everything else looks okay, is your range of motion has drastically reduced. So an infected total joint covers the whole joint, and then the capsule around it gets very, very thick and irritated and painful. So if you used to have 110 degrees of flexion in your knee, and all of a sudden you have 74 overnight or over a period of a couple of days, and you're still working hard, you haven't had any trauma, loss of range of motion or loss of function makes me very, very nervous about an infection.
Okay, that's a fair one.
Okay, number 5.
I have one that trumps that.
Okay.
This trumps it. This is 100% infected. You have drainage. And I don't mean right after surgery for the first couple of weeks. I mean like quite a while after surgery. You have a draining sinus, a hole there that's draining. It could be pus.
Does it have to be pus? That's a good question.
Doesn't have to be.
No, sometimes it could be bloody.
Yeah, it could be bloody, but something that's just continually draining
Yep.
well beyond the normal time frame of about 2 to 3 weeks.
And it's doing that because your body's trying to get rid of the infection, just like spitting out a splinter. It's pouring that pus out so it doesn't accumulate inside of your knee.
Or a rapper spitting out rhymes.
There you go. Okay, so now we know you got all these suspicions. You go to your doctor. What's your doctor going to do to help diagnose the infection?
Well, then there's some tests.
Okay.
First, there's a physical examination.
Yep.
The doctor is going to look at it.
Yep.
And examine it.
Yep.
And look for those things: swelling, effusion, range of motion, draining sinus.
You might have a fever. You might be tachycardic, possibly, if you're sick.
And then some investigations will be ordered. And
Can you see infection on an X-ray?
X-ray will be. I didn't even say X-ray.
I was so keen. I was like,
X-ray findings of infection are late.
Okay.
So those are late findings.
okay.
And usually that's loosening.
What about an
MRI? MRI is tricky because there is a prosthesis in place which will create artifact and make it hard to see.
Right.
So I don't routinely order an MRI.
Me either.
But there are things that we can see in the blood.
Okay.
So CBC, so complete blood count to look
Yep.
for a white cell elevation.
Yep.
ESR, erythrocyte sedimentation rate,
Yep.
which increases with inflammation.
Non-specifically.
Non-specific, but something that is more specific. So ESR is quite sensitive but not specific. CRP is more specific for infection.
Yes.
So we often order that to see if that's elevated too.
Right. And then I would say beyond blood work, I'd say the next thing that you could consider would be an ultrasound, and then obviously that leads into either just an aspiration or an ultrasound guided aspiration to get a sample of that stuff, send it to the lab and say, hey, can we see white cells? Can we see bacteria? And can we grow bacteria to find out the exact bug that's in there?
Look at it. And
Okay.
then some people, I've seen bone scans still ordered sometimes, which just show increased bone metabolism.
Okay. Are we going into treatment this video, or we're going to do another video about treatment?
I don't know. What do you guys want? You want to hear about treatment, or do you want to stop here? Okay. Well, we'll have to wait and see the comments.
Yeah. Okay.
We'll do
Leave a
another
comment if
video.
you want to know about treatment.
Yeah.
But now you know. So if you have the suspicion and you have the tests, now you got an infected total joint. This unfortunately does happen, thankfully uncommonly, 1% or less typically, but it is a very serious thing and needs to be dealt with.
But it can be treated. It's treatable.
Yes.
Remember, you are in charge of your own health.
We'll see you next time.